from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about congenital heart defects and how they can impact adults. Our guest today is Dr. Jeffrey Sell, Chief of Cardiothoracic Surgery here at SMH. Dr. Sell, thank you so much for joining us.
Happy to be here.
For those who don't know, what is a congenital heart defect?
So congenital heart defects are any heart defects that babies are born with or that they have from the moment of birth.
Can you give maybe some examples of the most common congenital defects or things people might have heard of?
So there are a lot of different things that people have heard of. Blue babies are usually due to a congenital heart defect. Problems with the aortic valve, bicuspid aortic valve, AV canal, those are very common things. Ductus arteriosus is a very common diagnosis. They're very rare. Congenital heart disease happens in about 8 per 1,000 live births. So it's a fairly rare problem.
And how has the understanding of congenital heart defects changed throughout the years?
So we've been able to diagnose them much better as we've developed echocardiography. Cardiac catheterization was used, but isn't as useful in baby hearts. Usually what we find in baby hearts is found with the echocardiogram, and now we can diagnose a lot of the congenital problems in utero before the babies are born. And then over the last 50, 60 years, we've been able to operate on babies with heart problems and fix them and give them longer lives so that now they live to adulthood, 60, 70 years of age.
We'll definitely get into that. Do all congenital heart defects, whether they were detected in utero or not, do they all have early signs and symptoms?
No, there are a lot of congenital heart defects that can be missed or that can develop over several days. And that's why pediatricians check on babies right after they're born. The process of going from a fetus in the uterus to an air-breathing mammal is a 24-hour miracle that has to happen, and several things have to occur for that to work. And there are a lot of things that, because you don't have to get your oxygen from your lungs, are not a problem before you're born. But as soon as you're born, babies can turn blue and those problems can show up. So some things, bicuspid aortic valve, for example, we operate on a lot of those in 60, 70-year-olds that didn't have any idea they had it until then.
So would you say most congenital heart defects are detected in children and treated in children, or would you say most of the patients are adults who maybe didn't know they had it? Or
most are detected in children.
Okay. So for those who are treated as children, is ongoing monitoring always required?
Yes.
What does that look like?
So usually it's being followed by a pediatric cardiologist and eventually to an adult cardiologist who has expertise in what's called adult congenital heart disease, so that they can be followed with echocardiograms, occasionally catheterization. One of the problems is that as we became more adept at operating on babies in the first days to weeks of life, things needed to be done that couldn't grow with the baby. So they have to be followed as they outgrow possibly a tube bringing blood to the lungs or things like that. And so that has to be very carefully monitored over the years.
And is that a very patient-specific treatment plan based on how they grow? I mean, just
very, very patient-specific.
Okay, so it's really important to have that relationship with the cardiologist.
It is, and it has to be a team. It has to be cardiologists, cardiac surgeons, excellent echocardiography, developmental people, all kinds of things that have to happen to bring those kids from the day of birth till hopefully old age.
Childbirth and having a child is terrifying for any new parent, and then add in a diagnosis of a congenital heart defect, whatever that is. How can what words of advice would you offer to parents? What would you say to parents who maybe are aware of this, looking kind of down that barrel of it's time to have treatment for our child? How do you kind of talk them through that?
The most important thing is to be somewhere where they have experience. You always want to be at the best center. Some things can be easily taken care of almost anywhere. As it gets more complex, it needs a lot of expertise in the surgery, in the echocardiography, in the cardiologist's role, and following these things, interventional types of things, stenting pulmonary arteries, ballooning valves. You need people with that expertise as the child grows. And so a lot of times we know before the baby's born that there's going to be a problem, and so they get transported right away to a center, especially if they need surgery in the first days of life.
But with the understanding of these congenital heart defects growing, these are not death sentences. There is treatment available, right?
Almost everything that we see can be treated, and we even where I started doing a lot of what I did, I ran a heart transplant program, so we transplanted baby hearts and in terrible congenital deformities that would have normally not been survivable. So there are always a lot of options, and the best is that we know before they're born to be prepared.
I know you said that most are detected before or as in young children, but are there specific defects people don't usually know about until they're older adults and experiencing symptoms?
So there are obviously certain valve problems that people don't realize. There's something called coarctation of the aorta, which is a narrowing in the aorta that sometimes gets missed as kids are growing up. And if we don't fix it before the age of 2, they end up with a long-term problem with hypertension. So good pediatricians have to keep an eye out for that. But mostly the kinds of things that we have are heart murmurs and echocardiograms and just seeing whether the baby's blue or not, seeing how fast the baby grows. And some of the problems will actually heal themselves in the first year of life. So it's a lot of decision making. Do we operate on this? Do we wait? Do we give it time? And it's a shared decision making with the parents, with the cardiology, cardiac surgery. It's a very complicated process.
So even if they've had repairs done as children, how can that come back and impact them as adults? What are the patients you see?
So a certain number of repairs that are done in newborns or very young kids require creating a pathway from the right ventricle to the lung blood vessels. And those are a fixed size. And if they're done in a very young baby, they may not grow appropriately. Or sometimes we would just patch that pathway and not put a valve in, and as they got older, that would cause the right ventricle to get overworked and need a valve to be placed to help their ventricle recover. Sometimes some holes in the heart don't show up for a long time until people get older. There's something called a foramen ovale that all babies are supposed to have, and that helps transport the blood from the right side of the heart to the left side of the heart when it doesn't need to go to the lungs. After you're born, that naturally closes, but in some people it remains open as they get older and older. And then sometimes you'll find people in their 60s and 70s who have this that manifest themselves as strokes, and we can often close those with a catheter-based plug unless they really need an operation.
For those defects which are not detected until they're adults, would you consider that more concerning or more deadly or dangerous just because they don't know they have it?
No, actually, it's because they don't cause a lot of problems until they get older. But as the heart changes its pressures and ages, sometimes those things show up when people are older. Also, sometimes we find them when we're going to do something that isn't a congenital problem. So sometimes we're replacing a heart valve and we find that they have this patent foramen ovale, this hole, and we then close that if it's necessary at the same time.
So because it's so patient-specific, what's your word of advice to anyone who is hearing as an adult, oh, you might have had this your whole life, it's a congenital heart defect, you need to see a cardiothoracic surgeon. They're being referred. What would you tell them?
Make sure that you keep track of any records you have, any studies that are done, so that people know what's happened, because it's often there are multiple operations that have been done, and it's important to know what's in there that we can fix and what we might need to replace. So those things are important, and also find someone who's been there and knows what those problems are. These hearts may look very different than average everyday hearts.
Yeah, talk about the importance of a high volume center.
Particularly in newborns, the high volume centers now use things like 3D printing to be able to understand the relationship of the arteries and the heart and things like that. So it's really nice to have a center where they do a lot of that kind of work. They're going to be used to seeing it, or they're going to be able to think through the process. They're also going to have a shared nomenclature with the people they work with, which has become very important in congenital heart disease.
For those with congenital heart disease, do they require things like cardiac rehab, like we see after some surgeries and things like that?
If we're doing it in an older patient, usually we like to see them go to cardiac rehab, depending on how completely we can repair them. Some people will go through life with a sort of a barely fixed kind of problem that may eventually need to have a transplant. So those patients need cardiac rehab to kind of maintain as they go along. And those are some of the more complicated problems that have not been successfully repaired until the 70s and 80s.
So how many patients would you say that you see, you or anyone, any of the other cardiothoracic surgeons at SMH see who had a congenital heart defect, maybe repaired as a child, that need further repair or cause issues as they're adults, maybe require additional treatments?
So we probably see somewhere between 3 and 5 a year typically.
Oh, okay.
It's a very small number if you don't count the bicuspid aortic valves. The bicuspid aortic valve is a very common problem, and we probably see 1 or 2 of those a month at least.
Okay. Is there anything else you'd like to add?
Well, so something very interesting is where do these problems come from? Because it's been a long discussion, and basically congenital heart disease has kind of a 3-pronged set of problems. One is a random mutation that happens. One is a genetic problem, and those, for example, bicuspid aortic valves fall into a group of left-sided heart lesions that are congenital, and that if you have one, you should have your children checked and echocardiograms and examined. And then there's a group that are related to intrauterine insults. And we used to see this with measles, particularly rubella. There's something called the congenital rubella syndrome, where kids were born with valve abnormalities, patent ductus arteriosus, and that was virtually eliminated with vaccination. But as we see more and more measles cases of the one version, we may see more and more of the rubella, because that's the same vaccine, MMR, measles, mumps, rubella. So we've eliminated that rubella process with vaccination, but now we're worried we'll see that again. Down syndrome, which is a genetic abnormality, has a lot of associated problems. There's something called the George syndrome, which has associated abnormalities. So anytime you have a congenital genetic defect, there's a significant chance there could be a heart defect associated with that. Some are very treatable, some are not, and it's important to know that.
So some of these congenital heart diseases are directly impacted by other diseases within.
Yes, or other syndromes.
All right, thank you so much for joining us, Dr.
Thank you.
And as always, if you liked this episode of HealthCasts, we ask that you like and comment, and visit smh.com/podcast to get to listen to more experts like Dr. Sell talking about health issues which matter to you. We encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.